Every year, millions of people around the world experience a stroke, and for many families, it seems to happen suddenly. One moment, everything feels normal. Then suddenly, someone cannot speak clearly, cannot move one side of the body, cannot stand steadily, and people often ask the same painful question afterward. How did this happen so fast? But here is something many people never hear clearly enough. In a large number of cases, the body actually sends warning signals before a major stroke happens. The problem is that most people do not recognize those signals when they appear, or they dismiss them because the symptoms disappear quickly. That is what makes this topic so important. Today we are going to talk about several warning signs that may appear before a serious stroke event, why they happen, what researchers and neurologists pay attention to, and why acting early matters so much. And I want to be very clear from the beginning. This video is educational. It is not a diagnosis, and it is never a substitute for proper medical care. But understanding these signs may help people have more informed conversations with their healthcare providers sooner rather than later. If you appreciate health information explained in a calm and practical way, subscribe to the channel and leave a like on this video. Now let's begin with something important. When people hear the word stroke, they often imagine one single medical event. But in reality, there are different types. One type happens when a blood vessel in the brain becomes blocked. Another happens when a blood vessel ruptures and bleeding occurs around brain tissue. The most common type involves reduced blood flow caused by blockage. And because the brain depends on a constant supply of oxygen and nutrients, even short interruptions in circulation can create serious problems very quickly. The brain may only represent a small percentage of total body weight, yet it uses enormous amounts of oxygen and energy every minute of the day. It never truly rests. That is why specialists often describe stroke care as a race against time. The longer brain tissue goes without proper blood flow, the greater the chance of lasting damage. But here is the part many people overlook. In numerous cases, the process leading to stroke develops quietly over many years. Blood vessels gradually become less healthy. Plaque slowly builds up. Circulation becomes less efficient. Inflammation and high blood pressure may damage vessel walls over time. This usually does not happen overnight. And because it develops gradually, the body sometimes produces temporary warning episodes before a major event occurs. Doctors often refer to these episodes as transient ischemic attacks, sometimes shortened to TIA. Many people call them mini-strokes, although specialists often prefer more precise terminology. The important point is this. These temporary episodes may act as warning signs that blood flow to part of the brain was briefly interrupted and then restored. Symptoms may last only seconds or minutes before disappearing. That is exactly why many people ignore them. The symptoms pass. People feel normal again, and they convince themselves it was nothing serious. But neurologists take these episodes very seriously because they can sometimes happen shortly before a larger stroke event. Now let's go through several warning signs people should know about. The first warning sign is temporary vision loss or sudden visual disturbance in one eye. A person may suddenly notice darkness, blurriness, fogginess, or what feels like a curtain, partially covering vision on one side. It may last less than a minute, sometimes only a few seconds. Then vision returns. Many people blame fatigue, stress, standing up too quickly, or eye strain. But specialists pay close attention to this symptom because blood vessels supplying the eye are closely connected to circulation going toward the brain. Researchers believe these temporary visual changes can sometimes occur when blood flow briefly decreases or when very small particles temporarily interrupt circulation in tiny vessels. And because the symptom disappears quickly, people often fail to seek medical evaluation. One man described it as if someone had suddenly dimmed one side of the world. Another person explained it felt like gray smoke covering one eye before clearing away moments later. The important thing is not to panic, but it is also important not to ignore sudden, unexplained visual changes, especially when they occur for the first time. The second warning sign is sudden numbness or tingling affecting one side of the body. This might involve one arm, one side of the face, one hand, or one leg. And the key detail is that it often appears suddenly and without a clear physical explanation. Many people have experienced numbness from sleeping awkwardly or compressing a nerve temporarily. That is different. What concerns specialists more is sudden one-sided numbness that appears unexpectedly and then fades. The reason one-sided symptoms matter is because different areas of the brain control opposite sides of the body. When blood flow briefly changes in certain regions, sensation and movement may temporarily become disrupted. Some people describe it as pins and needles. Others say the arm suddenly felt heavy, disconnected, or difficult to control. One woman explained that during breakfast, her coffee cup suddenly felt strangely difficult to hold with one hand. Several minutes later, the sensation disappeared completely. She almost ignored it, and that is what happens often. The symptom passes, so people assume the danger passed too. But temporary neurological symptoms deserve attention, especially when they are sudden and unexplained. Now let's move to the third warning sign: sudden loss of coordination or unexplained balance problems. Some people describe this as feeling dizzy for no obvious reason. Others say it felt like walking on uneven ground even though the floor was completely stable. A person may suddenly drift sideways while walking, miss a step, grab onto furniture unexpectedly, or feel a strong spinning sensation that appears without warning. The brain areas responsible for balance and coordination rely heavily on steady blood flow. And when circulation becomes temporarily disrupted, balance systems may stop functioning normally for short periods of time. What makes this confusing is that dizziness can happen for many reasons unrelated to stroke: inner ear problems, dehydration, fatigue, medication effects. All of those can cause dizziness too. But specialists become especially concerned when dizziness appears suddenly alongside difficulty walking straight, sudden imbalance, weakness, vision changes, or speech problems. One older gentleman described standing up from his chair and suddenly feeling like the room tilted sideways, even though nothing around him was moving. Within a few minutes, the sensation passed. At first, he blamed exhaustion. Later, after speaking with a healthcare provider, he realized the episode deserved much more attention than he originally gave it. And this brings us to an important point. Many warning episodes before stroke are brief. That is exactly what makes them dangerous. People tend to take long-lasting symptoms seriously, but short episodes are often minimized or forgotten. The body may give a warning only once before a more serious event occurs later. Before we continue into the next warning signs, take a moment to subscribe to the channel if you want more videos focused on healthy aging, circulation, brain health, mobility, and practical wellness information explained in simple language. Now let's continue with warning sign number 4, sudden speech problems. And this is different from occasionally forgetting a word or losing your train of thought when tired. That happens to almost everyone. What concerns neurologists is sudden difficulty speaking clearly or understanding language normally. A person may know exactly what they want to say, but suddenly struggle to get the words out properly. Speech may become slurred, words may sound mixed up, or sentences may stop making sense entirely. Sometimes other people notice it before the person notices it themselves. One family member explained that during a normal conversation, their father suddenly began speaking in fragmented sentences that sounded confused and unusual. Within several minutes, he returned to normal and insisted he was fine. But temporary speech disruption can be one of the clearest neurological warning signs because language functions depend on highly specialized brain regions. When blood flow is briefly interrupted in those areas, speech and understanding may suddenly change. And once again, many people dismiss it because it disappears quickly. That is why awareness matters so much. Now let's continue with another warning sign that surprises many people because it does not seem obviously connected to stroke at first. New or unusual headaches combined with other neurological symptoms. Headaches are extremely common. Most headaches are not related to stroke. Stress, Dehydration, neck tension, poor sleep, eye strain, and many other issues can trigger headaches. But neurologists pay closer attention when a person suddenly develops headaches that feel very different from their usual pattern, especially when those headaches appear alongside symptoms like dizziness, numbness, visual changes, or speech problems. The reason is that blood vessels themselves play a major role in how the brain functions. And when circulation changes suddenly, or vessel walls become irritated or inflamed, symptoms may appear in multiple systems at once. Some researchers have also explored how chronic inflammation throughout the body may contribute to vascular damage over time. The inner lining of blood vessels, called the endothelium, is extremely important for healthy circulation. When that lining remains healthy, blood flows smoothly. But over many years, factors like smoking, uncontrolled blood sugar, chronic inflammation, and high blood pressure may gradually damage that protective surface. Once that happens, plaque and clot formation become more likely. And this leads us directly into one of the biggest misunderstandings people have about stroke risk. Many people believe that if their cholesterol numbers are acceptable, they are automatically protected. But stroke risk is far more complicated than one single blood test. Blood vessel health depends on many interacting factors: inflammation, blood pressure, blood sugar regulation, smoking, physical activity, sleep quality, stress, and long-term metabolic health. One major factor specialists pay close attention to is chronically elevated blood sugar. The body needs glucose for energy. But when blood sugar remains elevated too often for too many years, blood vessels may gradually become damaged from the inside. Researchers believe this damage can make arteries less flexible and more vulnerable to plaque buildup over time. And importantly, this process may begin long before someone is officially diagnosed with diabetes. That is why prediabetes matters so much. Many people assume slightly high sugar is harmless because they still feel fine. But blood vessel damage can progress silently for years before symptoms appear. One physician explained it this way: the body often whispers long before it screams, and stroke prevention frequently begins during that whisper stage, not after major symptoms appear. Smoking is another major factor strongly connected to stroke risk. Cigarette smoke exposes blood vessels to thousands of chemicals repeatedly over time. Researchers have shown that smoking may damage vessel walls, increase inflammation, and make blood more likely to clot. This combination places enormous stress on circulation. And because stroke often involves blood flow interruption inside the brain, anything that increases clot formation or vessel damage becomes important. What many people do not realize is that smoking affects far more than the lungs. Blood vessels throughout the entire body respond to those chemicals constantly. That includes the vessels supplying the brain. Now let's talk about blood pressure, because this topic is often misunderstood too. Most people know very high blood pressure is dangerous, and that is true. Over many years, uncontrolled hypertension places constant stress on blood vessel walls. That stress may weaken arteries and accelerate plaque formation. But specialists also pay attention to situations where blood flow becomes too low in already narrowed vessels. Imagine a pipe that is partially blocked. Even small changes in pressure can suddenly reduce flow dramatically through that narrowed space. This is one reason some stroke events occur during sleep or early morning hours when blood pressure naturally changes. Again, this does not mean people should fear normal blood pressure fluctuations. It simply highlights how important healthy blood vessels are overall. Flexible, healthy vessels adapt better to these changes. Damaged vessels do not. Another important point people often misunderstand is age. Yes, stroke risk generally rises with age, but stroke is not limited only to elderly people. Younger adults can experience strokes too, especially when certain risk factors are present. Specialists may investigate things like clotting disorders, autoimmune conditions, heart rhythm abnormalities, vessel abnormalities, severe metabolic problems, or trauma in younger patients. That is why sudden neurological symptoms should not automatically be ignored simply because someone is too young. Now, I want to move into perhaps the most practical part of this discussion. What should people actually do if they experience one of these temporary warning episodes? First, do not panic, but also do not ignore it. Many neurologists emphasize that the period immediately after a transient neurological event may be critically important. Temporary symptoms deserve proper evaluation even when they disappear quickly. One important recommendation specialists often discuss is avoiding isolation after a possible neurological event. If symptoms suddenly become more serious later, having someone nearby who can notice changes and contact emergency services can make a major difference. Another point specialists frequently emphasize is not driving yourself if sudden neurological symptoms occur. Temporary vision loss, numbness, confusion, or coordination problems while driving can become extremely dangerous very quickly. Many people are tempted to wait and see, but that approach can delay urgent care during a time window when rapid evaluation matters most. Blood pressure evaluation is often one of the first things medical teams check during acute neurological situations. Extremely elevated blood pressure readings alongside neurological symptoms deserve prompt medical attention. This is why many healthcare providers encourage patients with stroke risk factors to monitor blood pressure regularly and discuss concerning readings directly with their doctors. And there is another extremely important point here. People should never begin taking blood-thinning medications on their own simply because they suspect stroke symptoms. Different types of stroke require very different medical approaches. Only proper imaging and medical evaluation can determine what is actually happening. Self-treating without medical guidance can be dangerous. That is why proper emergency assessment matters so much. Now let's discuss several evaluations doctors may consider when investigating stroke risk or transient neurological symptoms. One commonly discussed evaluation is ultrasound imaging of the carotid arteries in the neck. These arteries help deliver blood toward the brain. Ultrasound imaging may help doctors evaluate blood flow and identify significant narrowing caused by plaque buildup. Another commonly used evaluation involves long-term blood sugar measurement. Many people are familiar with a standard fasting glucose test. But another important test called hemoglobin, A1C, gives a broader picture of average blood sugar levels over several months. This can help identify prediabetes or diabetes that may be quietly affecting blood vessels over time. And another very important evaluation involves heart rhythm monitoring. Some dangerous heart rhythm abnormalities come and go unpredictably. A person may feel perfectly normal most of the day while still experiencing brief episodes of abnormal heart rhythm capable of increasing stroke risk. One major example is atrial fibrillation. This condition may allow blood to pool and clot more easily inside parts of the heart. Those clots can sometimes travel toward the brain and block circulation. The difficult part is that some people experience almost no noticeable symptoms. They may occasionally feel fluttering, skipped beats, or brief palpitations and assume it is stress or caffeine. Longer heart rhythm monitoring can sometimes reveal episodes missed during a short office ECG. And when rhythm problems are identified properly, doctors may discuss treatments and medications designed to reduce stroke risk significantly. Now let's step back and look at the bigger picture. Stroke is often not a random lightning strike from nowhere. In many cases, it develops after years of silent blood vessel damage. And very often, the body sends temporary warnings before a larger event occurs. That is the reason this information matters. Not to create fear, but to increase awareness. Because awareness gives people an opportunity to ask better questions, seek earlier evaluation, and potentially address risk factors before something more serious happens. Researchers consistently connect several lifestyle habits with better vascular health over time. Managing blood sugar carefully, working with healthcare providers to control blood pressure appropriately, stopping smoking, staying physically active, prioritizing sleep, eating a more balanced diet focused on whole foods. All of these may help support healthier blood vessels and circulation. And perhaps most importantly, temporary neurological symptoms should never simply be brushed aside because they disappeared. The fact that symptoms improved does not necessarily mean the underlying issue disappeared too. So here is what I want you to take away from this video. If you or someone close to you experiences sudden vision changes, one-sided numbness, unexplained coordination problems, serious speech difficulty, or unusual neurological symptoms that appear suddenly and then fade, take that seriously enough to discuss it promptly with a healthcare professional. Do not rely only on memory. Write symptoms down. Note when they happened. Describe what was felt. That information can become extremely useful during medical evaluation. And if this video helped make a complicated topic easier to understand, subscribe to the channel and leave a like. This channel is focused on practical information about healthy aging, circulation, mobility, brain health, and understanding the body more clearly. Thank you for spending this time with me today. Take care of your health. Pay attention to the signals your body gives you, and never underestimate how valuable early action can be. Before we finish, there are several things about stroke prevention that many people never hear explained clearly enough, and understanding them may completely change the way you think about your long-term health. Most people imagine stroke as a single, dramatic moment, but specialists often describe it differently. They describe it as the final stage of a process that may have been developing quietly inside blood vessels for years. That process often begins long before symptoms appear, long before diagnosis, long before someone feels sick. And one reason this matters is because people frequently wait for obvious symptoms before taking their vascular health seriously. But by the time severe symptoms appear, blood vessels may already be significantly damaged. That is why prevention matters so much. Not perfection, prevention. One important thing researchers emphasize is that blood vessels respond to daily habits over long periods of time. The body notices consistency. It notices blood sugar patterns. It notices smoking. It notices sleep deprivation. It notices inactivity. It notices chronic stress. And over many years, all of those things influence circulation and vascular function. For example, movement itself plays a major role in blood vessel health. When muscles contract during walking and physical activity, circulation improves throughout the body. Blood vessels remain more flexible. Blood flow stays more efficient. And this matters because inactivity can gradually worsen many of the same conditions associated with stroke risk. One neurologist once explained that the body was designed for movement, not endless sitting. And many specialists agree that regular physical activity remains one of the most powerful long-term tools for supporting cardiovascular and brain health. That does not mean extreme workouts are required. For many adults, simple, consistent movement matters far more. Daily walks, light strength training, stretching, gardening, staying mobile. The goal is not athletic perfection. The goal is preserving circulation, balance, strength, and independence over time. Sleep also plays a larger role than many people realize. Poor sleep quality has been associated in research with higher blood pressure, increased inflammation, blood sugar disruption, and changes in vascular health. And unfortunately, many adults normalize chronic exhaustion as if it is unavoidable. But the body performs much of its repair and recovery during sleep. Circulation, hormonal balance, inflammation regulation, all of these are affected by sleep quality. Another factor specialists increasingly discuss is chronic stress. Stress itself is not automatically harmful. The body is designed to handle short-term stress. The problem is constant stress with no recovery. When stress hormones remain elevated for long periods, blood pressure, inflammation, sleep quality, and metabolic health may all become affected. Many people carry tension in the body for years without realizing how strongly it may influence overall health. That is why stress management is not simply emotional, it can also become physiological. Now let's return briefly to warning signs because there is one pattern doctors see repeatedly. People often minimize symptoms when they occur alone. Someone experiences brief numbness and ignores it. Weeks later, they notice dizziness and dismiss it again. Then perhaps temporary speech difficulty happens once. Still, they wait. Individually, each event may seem small, but together, those patterns may paint a very important picture. That is why doctors ask detailed questions during evaluations, not only what happened today, but what happened months ago, what changed gradually, what symptoms appeared briefly and disappeared, because sometimes the clues are scattered across time. One very common phrase people say afterward is this: "I thought it was nothing." And that is understandable. The human brain naturally wants reassurance. People want symptoms to be harmless. They want temporary problems to disappear permanently on their own. But awareness changes outcomes, not fear, awareness. Another important thing many people misunderstand is family history. If close relatives experience stroke, heart disease, diabetes, or severe vascular problems, that information matters. It does not guarantee the same outcome, but it may influence risk levels and what doctors monitor more closely over time. Family history is information, and useful information helps guide prevention. Hydration is another surprisingly overlooked factor. The brain and blood vessels rely heavily on stable circulation. Severe dehydration can influence blood pressure, blood thickness, energy levels, and circulation efficiency. Older adults are especially vulnerable because the sense of thirst often becomes less reliable with age. Many people simply do not drink enough water consistently throughout the day. And while hydration alone obviously does not prevent stroke, supporting healthy circulation matters. Now I want to address something else carefully because this is where many people become confused by internet health advice. No single food, supplement, vitamin, or miracle cure can guarantee stroke prevention. Real prevention usually comes from a combination of factors working together consistently over time. Better metabolic health, better blood pressure control, healthier circulation, reduced smoking exposure, improved sleep, regular movement, medical follow-up when necessary. That is the real picture. And perhaps the most important thing is timing. People often wait too long. They wait until symptoms become severe. They wait until walking becomes difficult. They wait until blood pressure is dangerously elevated. They wait until a major event forces action. But many specialists spend their careers trying to help patients act earlier than that, because earlier intervention usually creates more options, more flexibility, and often better outcomes. One physician explained it this way: "The best time to protect your brain is before the emergency happens, not during it. That is why awareness matters, not to create anxiety, but to help people recognize when something deserves attention instead of dismissal. And remember this: temporary symptoms are still symptoms. Just because something lasted only 1 minute does not automatically make it harmless. The body sometimes whispers before it screams, and learning to pay attention to those whispers may matter enormously over time. So after this video, take a moment to think honestly about your own health. Have you noticed any sudden neurological symptoms recently? Any unusual dizziness, temporary numbness, speech changes, visual disturbances, episodes you brushed aside because they disappeared quickly? If so, write them down clearly and discuss them with your healthcare provider, not with panic, but with seriousness. Because conversations started early are often the most valuable ones. And if you found this video useful, subscribe to the channel and turn on notifications for future videos focused on healthy aging, circulation, mobility, brain health, and practical wellness information explained in clear language. Thank you again for being here. Take care of your health. Keep asking questions. Keep paying attention to your body. And remember that small actions taken early often matter far more than dramatic actions taken too late.